this afternoon, Governor Newsom announced plans to move into phase 2 of our stay-at-home orders for the state. Can we just start off and talk to us about, what kind of announcement did the governor make? How did you guys interpret that? What does that mean for Humboldt County?
Yep.
Sure.
Yeah.
So we were really excited to have the governor's announcement. I had a phone call with the state health department earlier that talked about some of the things that the governor would be addressing. And so, as everyone I'm sure can guess, it was welcome news for us, both that we would be moving forward soon. The governor plans sort of a soft opening to stage 2, which is where we can begin opening some businesses and other entities, and that will begin Friday. He's going to put out a specific order, I believe, on Thursday. And that will allow right out of the gate for businesses that are ready in their workplace with their worker protections and social distancing and such to be able to serve customers with curbside and delivery from retail establishments. So those were things that were not allowable under just essential services. So that's a big step in and of itself. And then the really big piece is that the governor indicated that if we are able to sort of provide documentation to the state about our readiness to move forward in terms of preparedness, that they are willing to review that and allow us to move forward at our own pace in our county through stage 2. So that brings the ability for us to add things relatively quickly, including things like restaurants, businesses serving people indoors, that type of thing.
Sure.
Yeah, and I think it's really important that Dr. Frankovich said is that it's our job as the county to attest that. It's not being individuals as far as the businesses goes, but we're going to attest to the fact that we are ready. And this is all the groundwork that Public Health and Sheriff's Office of Emergency Services have put together over the last, 3-4 weeks.
Feels like a while.
It does.
We've been working on these.
It does, but all this stuff, including the masking order, we're not wearing masks so we can actually communicate with you all today. But it's very important that all this groundwork that we've done and laid out over the last 3 weeks is going to pay off for us to actually attest to the state that we are ready for a potential surge, that we have expanded our testing, that the labs have expanded, that the alternate care sites, as well as our contact tracing, everything that public health has done to prepare us. And so I'm thankful for Dr. Frankovich's leadership there, and for us to be in the position now where we can rapidly get through to that phase 2.
And having that access to the EOC has allowed us to build infrastructure so we could do this response. So it's really been a good partnership here, along with working with the hospitals, the schools, everybody else. So I think we're in a good position right now, and the timing for our new test site was impeccable for us to move forward.
And the Sheriff, you briefly mentioned the readiness criteria that the governor had talked about. Can you go more into depth about that readiness criteria, and how does Humboldt County measure up?
Sure, and really it was, the governor was, it was sort of broad strokes in the announcement today. The state has informed us that we'll be getting some more detailed documents, hopefully later today or tomorrow, that will help outline all of the points they're looking for. But what I can say out of the gate is that in the instance of testing, for instance, they wanted us to be able to test at least 1 per 1,000 population on a daily basis. And we can do that right now with what we have between our internal lab and our Optum site that will be opening to the public shortly. So that we have covered. Other instances, we have to be able to accommodate up to a 25% increase in hospitalizations due to COVID, and we are there. I mean, we have really been quite good on that. And in terms of our communicable disease investigations, they want us to be ready to investigate additional new cases. So we've been building our teams. And where we are is actually about 10 times what we had to start with, and we're building further. And also the state did let us know that they are giving us some additional assistance across the state. They are building sort of task force teams that they can assign to counties if we need additional help in an urgent situation, as well as providing a training platform for us to get additional people on board, and also to provide a platform for us to be able to do communicable disease investigation across the state. So we're linked into our surveillance system, and we can communicate that way.
Okay. And I know that the governor talked a little bit about an accelerated path to phase 3. So, phase 2 launching the end of this week, and then we have the ability to go into phase 3 even faster. Can you talk a little bit about that and explain what an accelerated path really means?
Well, I think what's important too is, and we talk about accelerating paths and that kind of stuff, I think people do get excited about that, but I just want to take a step back just for a second. We're entering into that first step. And so people want to, start running, before we start walking, right? So we really have to walk through these next, openings of phase 2, so we're successful in a phase 3. I don't want to overly concern people, but the reality is that an outbreak could occur, and just one outbreak in one of our skilled nursing facilities could overwhelm our ICU, right? Which could make it difficult for just normal issues, emergency type situations to be treated here locally. So that's why we're cautious. That's why we want people to remain, in effect with these orders about masking, about slowly opening up this retail, and then over time we can get to that phase 3, which means that more things, more restaurants, and more things start expanding, and getting hair salons, and those things that are really, really important, for us all, and expanding businesses. That is very, very important to get to. I understand that, but we want to make sure that it is a slow, methodical step. And so every step of the way that we are prepared, and that our hospitals are properly equipped to handle any kind of surge.
And I think, that goes to that point that, the other features for the preparedness we have to report to the governor's office is around things like making sure vulnerable populations are protected, so that our skilled nursing facilities and correctional facilities have enough protective equipment, so that they have procedures in place to kind of help protect the residents of those facilities, and that we can accommodate that. And also that we have the metrics to be able to measure when we're getting in trouble with cases. So being able to look at our cases, our positives over a week, and tell how fast are those increasing, and is that of concern, so we can step back if we have to. Again, I think it's much less disruptive to people if we don't have to step back once we go forward.
Right.
And so again, it speaks to that just being, going forward faster, I expect, than a lot of areas of the state, because we're doing so well right now, but recognizing that if we do it the right way, we won't have to retreat, hopefully in a big way, and that'll allow us to just even slowly continue to move forward. So it's an exciting time right now, and we need to get those final pieces all together so that we can get the okay to move forward.
And the county had been exploring a tiered system of reopening and took that community feedback with that survey. How does this announcement from the governor, how does that factor in? How do they factor together?
Well, number one, we have to make sure that what the governor's orders is compliant with our orders. So he may have a different interpretation of what those phase 3 type businesses are as our phase 2 businesses. So we want to make sure that we're in line with the governor with that. The state does license a lot of facilities, and so we don't want state to come in and pull their licenses from businesses that are licensed in the state because they're out of compliance with the state orders. So we are completely in compliance with the state. We're going to be working with the state to make sure that those businesses that we do see essential and our high priority on as far as the local government's concerned, our chamber of commerce, as well as our citizens poll, that we'll get to those as quick as possible. But all that stuff's going to be taken into consideration. We're waiting for more guidance from CDPH today and the governor later on in the week. And so once we have all that guidance, we're going to be able to work with our city and county leaders to try and roll out what this next phase is going to look like.
Yeah, exactly. I'm very curious to see sort of what they're including in their stage 2 and their stage 3s. And they did indicate, even the state health department on our call today, that things that perhaps they've put in a stage 3 area, they're willing to look at plans and discuss further about, how that could look, and how it could look at a local level. So I think, as we move forward, I think there's really that opening for us to inform the process, which is important.
Sure. I think one of the biggest announcements that came out today was the regional variations.
Yeah.
I know that, Sheriff, you had last week, you had really been asking the governor to let the North Coast make the North Coast decisions, because we're so different regions here in California. So, what does this regional variations announcement mean to you?
So it means a lot, because number one, our guidance to our public health officer, Dr. Frankovich, has been right on point for us locally. And so for us to be able to make those decisions locally based upon the needs and really just how we can care for our county is really, really important. We have that level of focus here that maybe the state doesn't have. And so, but I just want to enforce one thing, that that, you know, we're looking local now. We're looking at how this thing works here, but realistically, we still want to make sure that essential travel piece is still a part of the state as well as our local guidance. We don't want people to travel just because now we're going into phase 2. Because we want people to make sure that they're staying local and that they make sure they still go by the state and local guidelines to really only travel for those essential needs. Because we want to make sure that we can open business up, but still not cause people to come in that maybe would bring in the virus from outside the area. And so it's an important focus for us to maintain that particular piece. But I'm happy that the governor's allowing that regional variances because we are different. We are different on the North Coast. And so we can allow it to be maybe a little bit different than the Bay Area.
Yeah, I agree. And I think that the point about travel is important because, you know, from the testing we're doing, I think the prevalence of infection of this virus is actually fairly low right now in our community. I think we shut down, obviously, at a point where we didn't have as many cases as they did in some other areas of the state, and it's been very effective. So what I don't want to see happen is travel to introduce a lot of virus into the community that we don't already have circulating here. And if we can keep that from happening, just because of people respecting the travel restrictions that are in place, then it gives us time to expand and become more and more prepared over time. So I'm really hopeful for that as well. And I also do want to mention that we do need to look at our surrounding counties. We're obviously very different than the Bay Area, but we want to look at our partners nearby, Del Norte and Trinity and Shasta and Mendocino and all those places for their readiness as well, because it can impact us.
And I know in this question might not be something you could exactly address, but people just want to know, when is this going to end? When can we go back to normal? With the governor's wanting to launch Friday with this phase 2, are we going to be going into phase 2 Friday, or do you foresee it to be a little bit next week? Do we have any kind of timelines?
So I believe, we will have, just like what the governor says, as far as that's kind of soft opening is going to happen on Friday. We believe that we will have some of those things in place for retail to open up as curbside delivery, and start putting those safety measures in place to do that maybe accelerated phase 2 for an opening. Once we get, once we attest to all the things that we have here in the county. But I believe that, we will be set up. Dr. Frankovich and the EOC has put us in a position that we can set up and go to phase 2 on Friday.
Yeah, and I think from our end, I think the governor opens that door. We can certainly revise the order locally to reflect that. And I think the big piece will be the businesses being ready again. Do they have the social distancing in their workplace? Do they have masks? Do they have the hand washing? All those pieces we're asking people to do. Even though they won't be dealing with customers on site, they will have employees there. So as long as they're ready to do that, it should become a reality very quickly. And then the idea I think we're looking at that's hopeful is that we'll be able to expand with the approval of the state to get that list of people up and running through much faster.
And there's, compliance certifications on the Humboldt County website. Do you think that'll help with the faith and?
Absolutely. So we're gonna expand our certification process. So we're gonna go over that and kind of work with the cities and the county to try and come up with a process that's going to be feasible for businesses as well as the county to make sure that certification implies that there's an amount of safety measures that each employer has put into play to make sure that their employees are taken care of, but also the public they're serving is taken care of. So we want that reassurance to actually be there for people to know when they start stepping out, that they know that they're going to be protected when they enter in the store, and that there will be things, those mitigating factors that we can use to help slow the spread of the virus if it comes in the community.
But I think what we're really looking at now is, at the outset it wasn't quite clear, but I think we're looking at over the next few weeks as opposed to, just expanding as people are ready, as opposed to looking at months. And so I think that's a really good piece of news that we got today for the community.
Great, and then every Tuesday you're doing board updates?
So when there's a Board of Supervisors meeting, Dr. Frankovich and I and Michelle Stevens are getting up there and talking to the board and giving them an update about where we are in the county.
So, and it's been, I think that's been a good venue for the residents to be able to see what's happening, and it is a great chance for us to update the board. And, I've really appreciated the board's support, the sheriff's support, the community, because it's been tough for everybody, and it's nice to be able to deliver some good news.
Anything else that you guys want to let the community know today about the governor's orders?
I think that covers it.
I do. We're
Nice.
you know, we're going to probably have another briefing, probably I would guess on Wednesday or Thursday, you know, sometime this week. When we start having more information from the state and the governor's office, there's going to be more for us to report out. And so stay tuned. Things that they, again, look at the safety measures that we put into place, okay, that we've asked people, the businesses to put in place. Start preparing your businesses now to do that. And then also masking order, okay? Understand that. And I do want to reassure one thing. And we got a complaint today from a citizen who had a disability and then was, you know, was kind of called out for not wearing a mask. So there are people that can't tolerate a mask. So please understand that there are certain people that are out there. But we want most people to wear a mask if they can tolerate it, because it's protecting other people. It's protecting loved ones, you know, that are in that protected classification. So we want to do our best to make sure we're protecting our community, and we're doing this for others, not necessarily ourselves. I know that, you know, it's tough, definitely.
Yeah, but those relatively easy prevention steps are the things that will allow us not to have to step back, I think, as we're trying to emerge from this. So I just think it's a contribution everybody can make.
Great. Thank you very much.
Thank you.
Thank you. Thank you.
Thanks.